Yes, good morning. So I think my role is to introduce today and kind of frame what we're going to be doing today and the kind of things we're going to talk about. My clicker, I need the clicker. So, I'm going to do a brief introduction. I have 10 minutes. I'll try and be as disciplined as I can. Today, we're going to talk about what's actually happening in Middlesbrough right now with the people that Ageing Better Middlesbrough has supported and engaged over the last 5 years. What we're specifically talking about today is the people who are the most lonely and isolated. So when we set out with Big Lottery six or 7 years ago to design this programme and really make the most of the investment, £6 million into supporting the most lonely and isolated older people, the biggest question was, A, were we going to find them? And B, when we did find them, what were we going to do and how were we going to help? And most importantly, what were we going to learn about what does it take to support the most lonely and isolated older people? And when you chuck loneliness and isolation into the same sentence, we realised really quickly that that's not necessarily very useful. Actually, if you chuck out the isolated bit, and we're just going to talk about loneliness, because that's the bit Middlesbrough and Stockton Mind really cared about. What does loneliness mean and how does that relate to people's mental health? And that's the learning that we have. So unashamedly today, we are talking about the most lonely people we have found in Middlesbrough. We're not talking about community development. We're not talking about groups and activities. We're not here to talk about cinemas, arts, entertainment, restaurants, cafes, because all of those things are completely out of reach for the people that we are talking about today. They're so out of reach, they're not even on the same planet that those things would be a realistic, actual realistic aim for in their lives. And we're not going to run away or hide from the talk around complexity today, because that's what we want you to talk about. So as somebody oh, there it is. So some of what we're talking about today, not rocket science. What we did in Ageing Better was we put a team of people together that provided long-term clinical mental health therapy with staff members who would provide more holistic, person-centred practical support. And we blended that team and asked them to work with people who would be deemed, thank you Tracy, as hard to reach. Those who are costing the services the most money, those who have been bounced around nearly their whole lives from service to service, those who are in and out of secondary and primary care services, those people who are what we call sort of hiding in plain sight. They weren't not known to services. They weren't kind of Ivy with her 3-bar fire who had been missed entirely. These are people who have been known to services a long time and whose lives are still miserable and who are still not being, whose needs are not being met by the current system we work in. So it's not really much of a shock that when you provide long-term mental health support and practical person-centred support, you can make a significant difference to people's lives. Made less of a difference to their feelings of loneliness, but I'm not going to ruin Javeria's presentation. If you go to Javeria's workshop today around what she's learned as a therapist working with these people, you'll hear a little bit more about the impact. We have managed to make a significant impact on people's well-being and on their mental health, and I think that's really important. Oh. It is down. Oh, there we are. So, more than anything, this is stuff that we already know. Everyone in the room will know about working with people with complex needs. This is a friendly reminder. We're not here to tell you that these things are new or innovative, just that some of the things we're going to talk about today, that they work. You're going to hear about peer support. You're going to hear about mental health interventions. You're going to hear about real human connections between people and relationships and time. And this is a friendly reminder that these things work. Sometimes it's useful to go back to the things that we know. Okay, there we go. So what does it take? This is what it takes, actually. Fundamentally, this is what it takes to support the most lonely and isolated older people to improve their well-being and their mental health. It takes flexibility. See, is that like flexible? It takes flexibility. Services need to be flexible. People need to be able to bounce in and out of services. They need to be able to take breaks. They need to be able to be supported through changes in their lives. It's about relationships between professionals and beneficiaries, but those relationships being about equality and choice. It takes time, and I don't mean, like 12 sessions. I mean 12 months. I mean 2 years worth of support for people, realistically, to really help people start to come to terms with some of the really difficult and complex lives that they're living, described by Tracy in her own family. If you think about your own life, and you think about how easy it is for your life to be completely sideswiped by things that happen to your mum or to your sister or to your children, and think about the impact that that has just on your ability to come to work every day. And then imagine those things layered on top of each other on a day-to-day basis. And and our expectation that people will recover in 3 months with 30 years worth of trauma that's happened to them in their lives. Oh, and the last one on that slide, sorry. Practical help. We can talk about volunteering and we can talk about empowering people to make choices, but the people that we've met in Ageing Better who are living in Middlesbrough right now, they're aged 50 to 70 in the main, they need actual help. And as social care providers, staff, commissioners, we need to not be scared of the word help, because the people we're talking about, that's what they need. They need empowering, but first off, they need help. They need help to sort out finances, physical health issues. They need transport. They need help to navigate their way through services. They need help and someone to listen to them. They need help in their homes. And that shouldn't be something that we shy away from as a community. The system. We talk about complexity. I go to lots and lots of meetings and conferences where we talk about complexity, but the systems locally are not set up to support people with complex needs. Fundamentally, the systems are still working in silos, so people are still being bounced around. And it's really important today that we talk, I go into loads of meetings all the time, everyone talks about the system. And that's what it looks like, and that's what it actually feels like. What Ageing Better's done, the work that our outreach and therapy team have done, is kind of squished in between the gaps a little bit. They're kind of like manoeuvring in between secondary care services, primary care services, and the community services. They're supporting people in and out of those things, and we haven't really made the system any simpler. In fact, in some cases, having read a myriad of case notes around who these people are, in some cases we've made it more complicated. The loneliness agenda has made it more complicated, because what some of these individuals need is care coordination over a long period of time with health and social care services working together. And our little bit has helped, but actually we're about loneliness. So if people can't determine that they're lonely, then we can't work with them either. So we bounce them out as well. And actually people being bounced around is part of the reason some of the people that we've met and supported haven't been able to be helped sooner in an earlier point in their life, so that they didn't have to go through some of the things that they have been through in the last 10 or 15 years. People bounce around. And what this leads to, if I click like 10 times. Oh, there we go. What it leads to is people with trust issues. So fundamentally, the people we meet when they get to 50 or 65, they don't trust they're going to be helped. People have high levels of apathy. Like, they just don't believe anything is going to work for them. And people are very the people that we've worked with have become very used to tolerating the pain or the distress or their loneliness, because they don't trust that services will help them anymore, because they've been let down so much in the past. That is the reality of the people that we're talking about today. Loneliness is a hot topic. It's been a hot topic for quite a long time. We have a loneliness minister. Ageing Better Middlesbrough is about loneliness. We have a campaign to end loneliness. Not quite as hot topic as this one. Oh, where is he? I'll bring him back. So I'm putting that out there early. We got the Brexit thing out there early. Not quite as hot as this, but it's still hot. We're still talking about loneliness a lot. And part of And that's really great. It is really great that the issue around loneliness is being raised, both health and social care staff and people are talking about loneliness. But actually, locally in Middlesbrough, our work has been dominated by people who are lonely, but their real issues are to do with physical health difficulties, financial hardship, and mental health. And I suppose my question to you today is, should we be talking about loneliness? Is the loneliness agenda actually just another way of not talking about poverty? Is the loneliness agenda easier to talk about than complexity? Should we be tackling loneliness, or should we be tackling the causes of loneliness? Thank you very much.